In the heart of medieval Andalusia, nearly 1,000 years ago, lived a man whose groundbreaking contributions would forever change the face of medicine: Abu al-Qasim Khalaf ibn al-Abbas al-Zahrawi. Known in the West as Al-Bukasis, Al-Zahrawi was born in the year 936 CE in the city of Al-Zahra, just outside Córdoba, in what is now southern Spain. His life and work stand as a testament to the thriving Islamic Golden Age, a period when science, art, and knowledge flourished across the Muslim world. Al-Zahrawi devoted his entire life to the practice and advancement of medicine, particularly in the field of surgery. His magnum opus, Al-Tasrif Liman, Ajiza, and Al-Ta'lif, a 30-volume medical encyclopedia, became one of the most influential medical texts of the medieval era. Completed around the year 1000 CE, this work not only gathered centuries of medical knowledge, but also introduced original insights, diagrams, and surgical procedures that had never been documented before. The most famous section of Al-Tasrif was its final volume, dedicated entirely to surgery. In it, Al-Zahrawi compiled over 200 surgical instruments, many of which he designed himself, and described their use with remarkable detail and clarity. These instruments included forceps, scalpels, catheters, and even tools for internal examinations and cauterization. Remarkably, many of his designs are still recognizable in modern surgical kits today, with some instruments remaining virtually unchanged in form or function. Al-Zahrawi emphasized the importance of a meticulous and humane approach to surgery. He warned physicians against causing unnecessary pain and stressed the need for cleanliness and ethical practice, a forward-thinking concept at a time when such standards were far from common. He was also a pioneer in surgical suturing, using catgut thread to stitch internal wounds, a material that is still used in modern surgery due to its ability to dissolve naturally in the body. One of Al-Zahrawi's most remarkable achievements was the early description of surgical procedures that would become standard practice centuries later. For instance, he detailed the removal of bladder stones through perineal lithotomy, performed tracheotomies, and even described procedures resembling modern cosmetic surgery, such as the reconstruction of damaged ears and noses. His treatment of dislocations and fractures, including the use of traction and splints, prefigured orthopedic techniques that would not be widely adopted in Europe until much later. Al-Zahrawi's influence began to spread widely after his works were translated into Latin in the 12th century by Gerard of Cremona, an Italian scholar who played a crucial role in transferring Arabic scientific knowledge to Europe. Through Gerard's translations, Al-Tasrif became a standard reference in European medical schools for over 500 years. It was studied and cited by prominent Western physicians such as Guy de Chauliac, who referred to Al-Zahrawi as the father of modern surgery. Beyond the realm of surgery, Al-Zahrawi also made substantial contributions to fields like dentistry, pharmacology, and obstetrics. He wrote about tooth extraction, dental prosthetics, and the treatment of oral diseases. In pharmacology, he described the preparation of medicines, syrups, and ointments, showcasing his deep understanding of both surgical and medicinal approaches to healing. His innovations did not stop at clinical techniques. Al-Zahrawi also focused on the education of physicians, stressing the importance of hands-on training, ethical responsibility, and the mental and emotional readiness of the surgeon. He believed that the practice of medicine was not just a science, but a noble service to humanity, guided by compassion and humility. The legacy of Al-Zahrawi continues to resonate in modern medical practice. The Royal College of Surgeons in London and institutions across Europe have acknowledged his work as foundational in the history of surgical development. His principles of instrument design, patient care, and clinical ethics are echoed in contemporary medical curricula, and his name is still honored in textbooks and lecture halls around the world. Al-Zahrawi represents a golden link in the chain of human knowledge, a reminder that the roots of modern science are deeply intertwined with the contributions of Muslim scholars. At a time when Europe was still emerging from the shadows of the Dark Ages, Al-Zahrawi and his peers were performing complex surgeries, writing encyclopedias, and shaping the future of medicine. His story is not just one of scientific brilliance, but also of dedication, faith, and service. As a devout Muslim, he saw his work as a form of worship, a way to benefit humanity in accordance with the teachings of the Prophet Muhammad, peace be upon him. This harmony between faith and reason, between science and spirituality, defines the enduring legacy of Islamic civilization. Thank you for watching this episode of Islam with Aslan. If you found this journey into the life and legacy of Al-Zahrawi inspiring, don't forget to like this video, leave a comment with your thoughts or questions, and subscribe for more engaging content on Islamic history and contributions to the modern world. There's so much more to explore. Join us as we uncover the brilliance of our shared past.